To have you back. Let's bring you this now. TB is one of the leading causes of death in this country, and that's according to Statistics South Africa. Now, the Human Science Research Council, as well as the University of KwaZulu-Natal, are hoping to reverse this trend through the Connect TB study. The first client in the novel study successfully completed treatment for tuberculosis last month. But for more on this, we're now joined by UKZN public health specialist. That's Dr. Tsholofelo Mhlaba, of course, co-leader of the Connect TB study. Dr. Mhlaba, thank you for your time and good morning to you. Before we get into, the details around this study and the success story you have to share with us, let's talk about what Connect TB is all about. What are we hoping to achieve here with this Connect TB study?
Thank you, Tumelo, for the opportunity. The Connect TB study essentially is a study that's funded through the Stop TB partnership and through the TB Reach. And it's essentially aimed to fast-track a population intervention that seeks to reduce TB diagnostic and TB diagnosis and TB treatment in the private sector. So now what is happening is that we have a collaboration with the HSRC and UKZN, and we are actually implementing that study right now. We started seeing patients from May. So we're working with GPs in the private sector, And what we are trying to do is we want to fast track and make sure that patients receive the diagnosis of TB and treatment in the shortest possible way.
Right.
So what we are doing now, yes.
So with that being said, Doc, as you add on to your answer, because I know you had more to say, I know that you also bring some very, very much good news here in the sense that the first client in the Novel Connector TB study successfully, as well as timelessly completed treatment for TB at the end of October 2021. Surely this is a milestone. What does it particularly signify?
Absolutely. We are so excited to experience that, and we're having beautiful testimonials from our patients. This first patient we're really proud of, and really we want to acknowledge the adherence facilitators who have been who are part of the study, who are actually in constant communication with our patients to troubleshoot any problems. They are offering support, if there's any questions, any guidance. And, that is so important because, rather than the patients going to the facilities for things that they need or questions, or maybe problems with side effects, they're able to rather speak to the adherence facilitators to be able to help them with that. That's reducing, the facility visits, especially even now in the context of COVID. That works very well. And also we had an unrest recently, and our patients were then able to, through the adherence facilitators, able to be redirected to, facilities that may be able to see them. Because as you remember, we've had problems where GP practices were damaged, looted, and patients were stranded. Yeah. So that was really helpful in that way. Thanks.
And I'm glad, Doc, you mentioned TB in the context of, COVID, and also obviously those July unrest causing further havoc, as we're seeing in the country. We know at this stage TB is one of the leading causes of death, hence this study, because you are trying to protect life, preserve life, and ensure that you have an efficient way of testing, but also successful treatment. With that being said, how has testing for TB been like from a medical perspective during the time of the COVID-19 pandemic?
Yes, we've had challenges, and there have been recent studies and observations that have been done in that we have seen a decline of diagnosis and treatment of TB, essentially because a lot of patients who are suspected to have TB, who are ill at home, are really scared to go to the facilities because of the perception that they may get COVID. So it's really a challenge, I think, for the health system, and it continually is. though now with the decreased, with the levels of lockdowns, coming down, we are seeing that improvement. So it's very important that even with this study we become relevant to the context. Ensuring that even patients who are unable to go to the facilities, patients who are scared to go to the facilities have means to access care through the adherence facilitators that we have. They're able to reduce patient visits. They're able to rest. Patients are rest assured that they may be able to.
Well, Dr. Mhlaba, thank you so much for talking to us, and we appreciate the efforts you're making, yourself and your colleagues, in making sure that testing for TB is done seamlessly, conveniently, but also treatment is successful. Those efforts, much appreciated. Dr. Tsholofelo Mhlaba talking to us there, of course, from the University of KwaZulu-Natal.